So I'm Megan, second year clinical nephrology fellow. I want to do a thank you first for Carrie for letting me go a very different direction with my scholarly project. Um, yeah, so this is about listening. Um, the background is actually that I used to be a professional musician. I think most people know that, but I started playing violin when I was 7. This is my first summer playing violin. Um, I actually went to music school first in New York City, and I worked professionally for 3 years as a musician before doing a post-bac and going back to medical school. And I played while I was in post-bac and medical school a little bit professionally until we started clerkship year, and then it was really quite impossible to do both. Um, so I think my last concert was now 8 years ago or something. But it was a huge part of my life. I'd argue still that it's a larger part of my life than medicine. Um, and it sort of inspired a lot of the things I think about in medicine as well. So the job I had after I had graduated was mostly performing chamber music. For those of you who have not heard me talk about string quartets yet, chamber music is small groups of musicians playing together, usually anywhere between 2 and 10, without a conductor. It was originally meant to be played in a room, in a small chamber, just for your friends, very casually. The sort of like what I think is the most important part of chamber music is the string quartet, which is 2 violins, a viola, and a cello. Most composers wrote numerous string quartets. It's kind of like the ultimate musical form, which can be debated, but I see people nodding their heads with me, so I think some people agree. There's a movie called The Quartet that's actually not too inaccurate about what it's like to play in a string quartet, and it really is. If you go to music school as a string player, it's really what everyone sort of wants to achieve, is to be able to play in a string quartet, just because of how intimate and emotional it is with the people you're performing with. So I spent some time doing that, and then I started medical school. And I was really there's a lot of crossover between music and medicine. I know a lot of you are musicians, a lot of you enjoy music. And so I was trying to sort of translate my experience from music, also just to explain to people why I had this huge life shift. But there's a lot of similarities. When in music, you learn a new language by reading music, and medicine is certainly a new language. Learning the biochemistry, all of these building blocks we had to learn just to be able to understand medicine. There's so much technique in music. You spend your whole life practicing scales and etudes. That never goes away. And in medicine, we're constantly building illness scripts, finding new differential diagnoses, learning about new diseases. And then from my career in music, chamber music, I really felt this interesting phenomenon of sitting in a string quartet, doing something that was so hard myself, but still having to listen and understand what everyone else was doing and put that all together. And then when I started doing patient interviews in medical school, I realized it felt really similar, that I was sitting there doing something extremely difficult, but there was somebody else who I had to incorporate and listen to and sort of have this conversation with about what was going on. And I really wanted to sort of see and try to explain why I felt sitting in the middle of a string quartet helped me be better in patient interviews. And originally my dream was to have everybody somehow sit in the middle of a string quartet and experience what I've experienced. And while I can't get everyone to start playing violin when they're 7, I sort of tried to go about it a little bit of a different way, and really just try to answer the question, how can we practice and improve our listening, and incorporate my background while recognizing that not everybody has a musical background. And so my project actually culminated in a workshop for the internal medicine residents. I did this recently on April 17th in their academic half day. For those of you who don't know, academic half day is on Thursday mornings. It's when all the medicine residents disappear from service. It's on their elective rotations. And they go sometimes in person, more often on Zoom, to 3 45-minute lectures that are anywhere from just medicine things to more, I guess you could say, esoteric things like mine. They actually were able to give me 2 back-to-back lectures, so it ended up being an hour-and-a-half workshop. It was mostly for second and third years, because the interns actually had to leave 45 minutes in, so they sort of heard the first part of it and then they had to step out, and then the senior residents were there for the rest. And so the basic things I wanted to go over, since it was an academic half day, we did look a little bit at the research of how are we actually taught how to listen, how is it incorporated into medical training, and what's actually emphasized about communication. and then to reflect on everyone's own education, or if they've thought about listening in medicine, if this is brand new to them. And then the second half, the second 45 minutes is really just about practicing listening. And so the first step would be to see, why is this actually important? And there's not research on this. I think it's just obvious that active listening helps us take better care of our patient. It helps us focus on what's important to the patient. It's really important when we talk about patient-centered care to know what the patient actually is worried about or interested in. You hear details you may not have thought to ask, but that are actually relevant to the clinical picture. And I see Chris Blosser here, and I remember we were on for a weekend together, and the patient was intubated, but the whole family was there for the weekend. And they said, oh, we can only come on the weekend because, we have a lot of animals at home to care for during the week. And we were just chatting. We said, oh, what animals do you have? They're like, oh, well, she, the patient, actually takes care of all of our birds. And this was a patient with pneumonia in the ICU. And I think we both looked at each other and were like, have you told infectious disease that you have birds? And we were just chatting, we weren't probing for the information. I don't think it ended up being clinically relevant, but you just never know when those things will come up and you didn't think to ask, or the patient doesn't know that it was important to mention. And then you can troubleshoot issues with access and adherence. And I think this is most important in our dialysis patients who frequently miss dialysis. We kind of sometimes just say, oh, this person misses dialysis, they don't go, but we could actually talk to them and listen deeply about why they're missing, what the problem is, and maybe change their adherence. And then I think, above all, just taking care of patients, it's really that we get these moments of human connection. I would argue that everyone in this room went into medicine hoping that we have moments of human connection, and it's what keeps us going. And if you're actually listening to a patient and you connect with a patient, I think it's what keeps us going from day to day. So a little bit about how this is actually incorporated into medical training, and the short version is it's not. We're trained really well on communication. So this was from the Kalamazoo Consensus Statement, which came out of a 1999 meeting on sort of the essential elements of communication in medical education and in medical encounters. And so you can see on the left, they have sort of a list of competencies in communication and interpersonal skills. This is basically everything outside of medical knowledge. And then on the right, they have what could be made into sort of a checkbox for each thing. When you're watching a medical student in a patient interaction, did they make a personal connection? Did they elicit the patient's perspective? All these things could be checked off on an OSCE form or some sort of evaluation. And all of these are important. Express empathy. We use open and then closed-ended questions. We use summaries and transition statements. We use everyday words. I always introduce myself as a kidney doctor, not a nephrologist. We check the accuracy of the patient's understanding. And so these are sort of the things that are emphasized in our medical training. And it seems obvious that all of these things require listening. But the only place listening actually comes up here is one of the competencies is listen effectively, and then it's connected to allow the patient to finish an opening statement. And I will be the first to admit, I've let patients talk and talk and talk so that they feel like they're being heard, and my mind is going to how late I am for the next patient, or how I can't get into the medical record for some reason, or the epic chats that are coming in about the inpatient. And so even if the patient finishes their opening statement, I'm not sure I've completely listened to what they're saying. When I did this for the residents, I had them close their eyes and raise their hand that, who else has done that? And it was quite a few people, but I won't make you all do that. This is actually from a paper that looked at all of the evidence and recommendations on communication skills in the patient-provider relationship, and they sort of distilled it all into the 5 recommended practices to foster meaningful connections with patients. And I like some of these more than others, but preparation with intent before seeing the patient, listening intently and entirely while sitting down. We've all been in the Harvard UED, there's nowhere to sit down, so, we take what we can. Formulating an agreed agenda with the patient as to what matters most, and connecting with the patient's story, exploring emotional cues by naming and validating the patient's feelings. And they sort of implemented this and saw what happened, and it led to improved communication, satisfaction, and perceived provider friendliness as assessed by the patient. But interestingly, when they sort of went through those checkboxes before and after training that incorporated this, the number of checkboxes checked off didn't change. So it was really perceived by the patient, but there wasn't really a way to evaluate it, like in a medical training situation. So then they had another meeting. this is from the Kalamazoo 2 report, where they were talking again about these skills that are important for medical training. This time they actually separated it, which I really like. They separated it into communication skills and interpersonal skills. And I think if you look at communication skills, this is really the specific tasks and observable behaviors. So these are the things like, is the provider nodding and saying as the person is talking? Do they respond with empathy? Do they say the empathetic statements? I think on my first OSCE in med school, I was dinged for not saying enough empathetic statements to the patient who came in with a headache. There are like a number of check boxes for that. But I think actually the right side, interpersonal skills, is the hard part to evaluate and to teach. It's really just if you created a trusting relationship with a patient. And these are all described as humanistic qualities: respect, paying attention, being present, having a caring intent, and just mainly understanding, having empathy, and relational versatility. And I think the difference between these two sides to me is that communication requires hearing the patient. You actually have to hear their responses, but the interpersonal side really is more about listening to the patient and reading between the lines and not just hearing the words they're saying. And this is really hard. So why is it so hard? Everything we do is hard, but in medical training, we're really trained to prioritize the problem solving. So when we go into an OSCE or patient encounter in medical school, the point is to come out with your differential diagnosis, your top 3, and then your next steps in workup and management. And to get there, you do have to listen to the patient, but in the entire patient encounter, you are just focused on what those things might be. We're being graded and evaluated on the differential diagnosis skills. You know, when you present to your attending, they want to know your plan. They want to know what your CRT prescription is. And those are the things that are actually you're sort of being evaluated on. We aren't knowledge experts. You know, I did this for the residents, but I still don't feel like a knowledge expert. And I think in nephrology, that's going to last for a very long time and maybe forever. And I think we don't realize how much practice we need. And so we practice differential diagnoses, we practice putting in dialysis prescriptions, but we don't actually have an opportunity to just practice how to listen. So when I was in medical school, I was actually able to do a sort of similar project, a humanistic scholarly project. I worked with one of my attendings at NYU who actually was also a former musician, saxophone player, and created a project where I was interviewing musicians and physicians about how they listen, how they think about listening, how they've been trained, and how they think it's sort of incorporated into their daily life. Unfortunately, it was interrupted by COVID, so I got about halfway through the interviews. But these are the questions I asked them, and they've been updated a little bit since then. But in the interviews, I was asking, what does listening attentively mean to you? What kinds of things make it difficult for you to listen? How about things that make it easier? At what moments in your work do you feel like you're consciously thinking about listening to others, either patients or your colleagues? And what does that look like for you? How can you tell when others are not listening attentively? Or how about when they are? What kinds of training or experiences have been helpful to you in learning how to listen more attentively to others? And how has your approach to listening changed over time? And so in our workshop, we then went into our practice session. And I don't actually think I have time to play it for you, but this is, the first thing we did was listen to a 4-minute clip of Beethoven String Quartet, Opus 132, the Heiliger Dankgesang, which is a very slow movement. 4 movements was a big ask. 4 minutes was a big ask, I mean, but the entire piece is about 45 minutes long. This is a Danish string quartet. I'm completely obsessed with them. If you want the YouTube link, I will send it to you. But I just had them listen to this, no prompting. You know, I just said, this is my love, this is what I listen to, so we're just gonna listen to this. And so we listened for 4 minutes, and then I just asked them, we could, if we have 4 minutes at the end, I'll go back. I just asked them, what did you hear? And this was really interesting because within the residents there were also musicians, and there were people who have never heard of Beethoven String Quartet in their life. And so there were musicians saying, oh, I heard that when they played this chord and then they went to this chord, it really changed the tone, and they were, you know, speaking like a musician. And then there were other people who said, I heard it sounded like they were talking to each other, and everything in between. And it was really interesting to see. I didn't actually expect anyone to have like the musical words to say what they were hearing. and it was interesting for them to talk about it as well. And then taking a step back and just thinking, you just stopped, did nothing else, and listened to music for 4 minutes. How did that feel? What kinds of things made it hard for you to listen to that? It was quiet in this room. No ambulances went by while we were doing this. And then sort of comparing that to what things make it hard to listen in medicine. And this was similar to a lot of the question, or a lot of the answers I got when I was interviewing physicians, that just distractions, the technology, the EMR, that can make it hard to listen. Your mood and alertness. Were you at the hospital until 3 a.m. the night before? Now you're in clinic trying to listen to your patients. Sometimes with medicine, we sort of have a to-do list for the interaction. You're like, this is the visit where I'm gonna get them to go up on their blood pressure medication. This is the visit where I'm gonna really figure out if they want to do dialysis or not. And we always sort of have an end goal for the visit, and that might be a plan or a diagnosis or something. And then the biggest one for me, and I think for a lot of the residents as we were talking, is just not getting stuck in your own thoughts. As the patient is talking and you're trying to think of what questions to ask them, what diagnosis you think is going on, which pertinent questions you should ask next, you're not actually able to listen to the patient finish talking while you're sort of forming your next thoughts and trying to think about what you're going to say. And so that really led us to, how do we get out of our own head? And the biggest things that came up when I talked to people were, a lot of people do meditation. I think if you are able to continue to hone your skills and knowledge, then you're not as focused on trying to come up with the answer, and you can listen more while knowing that you're sort of subconsciously still thinking about the medical knowledge part of it, but that's really hard, and I think that takes, probably a long time in your career to get to. And then I think just being able to prioritize focus, so taking a moment to actually focus on what's going on, maybe ignoring your epic chats and letting those notices come in and out of your mind, and just taking a moment to like prioritize the listening of the situation. And so the next little exercise we did was a meditation exercise. This was only 2 minutes. And I was the first to admit that it's hard for me to meditate. I have a lot of thoughts coming into my head. I know you're supposed to bat them away, like Headspace says, but they just stay there and they really interrupt my thought process, which I guess is the whole point of meditating, is to get rid of your thought process. I know a lot of people meditate. I've talked to Anne a lot about this. Obviously, we all know Abal quite well. I know there are fellows who are working meditation into their life. And so we listened to this 2-minute meditation, and we're just thinking, how can this make you a better listener? And for me, it's really about being able to listen to the patient, having those thoughts come in and out without actually distracting you and taking you in a different direction. And for me, that's a lot like music, playing in a string quartet. If I'm playing something really difficult, but I still need to hear something else going on, I can still hear what's going on without it distracting me from what I need to do as well. You don't need to meditate. And then we just went into a practice. And so what I had the residents do was think of a recent life event, favorite childhood story, anything that doesn't have to do with medicine, pair off and just tell each other a story. One person is only focused on listening. They don't have to tell me anything about the story. They don't have to react in any way. They don't have to make a list of questions to ask. Just listen and think about how that feels. So they all turned to each other. They each took a turn sharing stories, and then we came back together to think about how it felt to listen. And a lot of people said, oh, I noticed I wanted to interrupt, and then I didn't, but then I couldn't stop thinking about what I wanted to say, and I'm not sure I heard their whole story. A lot of people said, since I knew we were focusing on listening, I felt like I was really tuned into the story, and I was like really in it with them, and had, was experiencing it with them. And so I think it was really helpful because we don't have opportunities in medicine to just focus on the listening. Even in medical school, that's really not a part of our training. And there's not really a place to practice it. And so this was one way to practice. I think when I was interviewing physicians about how they think about listening, it was really interesting. One of my friends who was a resident at the time when I was a med student said when she was in medical school, they had to drive all over to their rotations, like hours away to each hospital for their rotation. And so she would carpool with somebody, and while they were driving, they would just talk to each other, and they didn't have the radio on. And she felt like she got better at listening by just focusing on it in these long car rides. I feel that way a lot when I go hiking with someone. There's, we just talk and you realize how closely you're listening to them. One of my med school classmates did a lot of improv comedy where you're reacting to what the other person said. And to be good at it, you actually have to really listen to what they said, but you're also trying to think of what you're going to do to be funny. So it's really similar to music in my mind. And then there's actually a lot of literature about jazz improv with medical training as well. So I think there's lots of ways to focus on this. You don't have to listen to Beethoven quartets, but that's where my passion is and where I'm coming from with this. So then I made them listen again. Originally, I had this in there 3 times, and I was told it was one too many. We listened to the same 4-minute clip. We listened to it, no prompting, exact same 4 minutes, and then I just asked, what differences did you notice? And people said, we were more focused on the listening. We had all this time to practice. We weren't worried about what you were going to ask us afterwards, and it was just easier to actually focus and listen. And so I didn't have any sort of evaluation or agenda for the residents of like a pre and post test of how well you listen. I don't even know if there's a way to create that checklist or agenda with the idea that we don't want to be evaluating everybody on this process, and maybe that checkboxes aren't the best way to actually evaluate people. So I spoke to some residents afterwards just to see a couple weeks later, like, have you thought about this? Have you noticed anything when you're talking to patients or in any part of your life? And one resident, I really liked what he said. He's one of the 3rd years. He said, the session made me think more about what I was listening to rather than what I had to say next. It made me think more about what really listening to another person means rather than just hearing them. And I think this really sums up what I was hoping for. And I think it's really hard to remember this kind of the second you walk into the hospital. Your pager's already going off, or your attending's already messaging you about changing someone's dialysis orders. But I think if we have time to actually practice, or you figure out how in your own life it works for you to practice this, whether it's a long car ride, a hike, you want to go to some chamber music concerts, I think it will help us take better care of our patients. I think if we did a poll of all of the specialties, nephrology would probably be higher up on the ones of people who listen attentively to their patients already, just because of the type of people who go into nephrology and the type of patients we care for. But I think we can all practice, and I really hope that this is something I can keep doing for the residents and maybe expand into other areas. My ultimate dream, like I said, is to everyone experience a string quartet. So if I can get the Danish string quartet to come play, that would be amazing. But until then, I think just, coming up with ways to practice listening without the medical side of it really interfering. So I could thank everyone, because I think I've probably talked to everyone about these ideas, but Anne O'Hare was my mentor for this project, and I really appreciate everything she helped with in talking about these ideas and the books she gave me and the podcast I listened to. And then Justin, I actually asked very last minute to come watch and observe and just give me any feedback, and he was able to come over and see the workshop, and I really appreciate it.